Okay, good evening, everyone, and thank you for joining us this evening for this evening's webinar brought to you by Steriplast in partnership with Basrat. Just a few housekeeping rules to start off with. Please feel free to introduce yourself via the chat. It's great to see who's joining us this evening. Any certificates will be sent out after this evening's webinar, probably the next couple of days. Imtiaz is webinar will take around 45 minutes, followed by any Q&As around 15 minutes. So if you do have any Q&As, please enter them into the Q&A section. And if you have any specific questions that you see you would like to upvote, then please do. And Imtiaz is happy to take any questions in relation to his role as well. The recording will be available afterwards, and you'll be sent a link. So please don't worry about sending us an email. We'll get a link across to you as soon as we can. Just a little bit about Basrat. We're the professional association and regulator for sport rehabilitators and trainers. We provide regular CPD webinars for our registrants and associate members. So if you are a physio, chiropractor, osteopath, or healthcare in a healthcare profession and you're interested in becoming an associate member, please feel free to get in touch. You can see the list of benefits listed there below. It's only £5 a month, and you'll be helping to support our webinars going forward and other things that we provide. I'm just going to introduce Andrew Watson from Steriplast. So over to you, Andrew.
Thanks, Ryan. Evening, everyone. Thanks very much for joining, and thanks very much to our expert guest speaker, Imtiaz, for another presentation. As Ryan said, please do sort of introduce yourselves in the chat, and while Imtiaz is talking, please do put any questions into the Q&A, and we'll take those questions at the end. So I work for a company called Steriplast Healthcare. We have over 25 years of experience in medical consumables. So our background is in the healthcare and emergency services sector. I lead on our work in sport, and we're working in partnership with sports teams, organisations, sports rehabilitators, and a whole range of other professionals that are involved in sports rehab. We've recently launched a new range of online sports taping and kinesiology taping courses, so please do have a look at those if you're interested. If you could just move it on, please, Ryan. So the Injury Rehab Network, we started in 2019 as a means for some of the partners and professionals that we're working with to collaborate and to share good practice. And at that time, they were face-to-face events, and the format was we have a guest speaker, some facilitated networking, and opportunity for people to share ideas and good practice. With lockdown, it forced us to take the events online, and we've been really pleased to be able to work with Basrat to bring these events online, and I think it's helped to make the events available to a wider audience and a global audience thanks to the networks of Basrat. So we're really pleased with that. We're delivering our events in support of a local charity based in Manchester called the Running Bee Foundation, and the Running Bee Foundation invests in healthy and active causes. So if you would like to support the work of that charity, please do have a look. One of our next event is going to be a face-to-face event, and the registration fees for that, which will be £5 a person, will go to the Running Bee Foundation again. So please do save the date and keep an eye out for that and get involved, anyone that's based in the Northwest. And then moving into 2022, we've got Michael Blackie, he's a sports dentist. He'll be speaking in March. In April, we've got Steve Kemp, the England football lead men's physio. And then in June, we've got Andrew Newton, who's a consultant in emergency medicine, and he'll be talking about some of the paediatric sports injuries that occur on a regular basis that he sees in his A&E department. So there's a link there to the events, and we're sort of continually updating and adding to those. So I don't like to sort of introduce people myself. I think our guest speakers are always best to do that themselves. But as I said before, thanks very much to Imtiaz for sharing his expertise. I'm sure it's going to be fascinating hearing all about his role as head of medical at Queen's Park Rangers. So thank you, everyone. Hope you have a good evening. And as I said, please do continue to put your messages into the Q&A.
Okay, thank you very much for the introduction. I'll make a start. So my name is Imtiaz Ahmad. As mentioned, I'm the head of medical at Queen's Park Rangers. I'm also co-chairman of the Efl Medical Society. We organise similar meetings like this quarterly, which have now gone online as well, like most meetings at this stage. I also work as a medical advisor to the Pakistan cricket team, and I do some voluntary work for a charity called Coping Through Football, which works with patients with severe mental health illness, and they essentially get together for weekly football sessions where they gather together and help each other with their as a support network. So my role today is okay, good. So this is what I'm going to cover. So this talk would have been very different many years ago. If when I first started off in my role as a football club doctor, I would have probably talked much more about emergency care and injuries. But I was specifically asked to kind of give a more general overview about what it is like being a doctor as a head of medical at a professional football club. So I'll touch on a lot of these areas. And in particular, with a bit of a flavour of how COVID has affected things over the last 18 months, talk about team working and also leadership within a football environment. Of course, I'm here for the end as well, so if anybody wants to ask me any more specific questions about any other areas, then I'm very happy to take that, but I'll just run through this. So QPR, I put up this slide because we won the last two games, but also just to show where we're coming from. So I always like to give a bit of a background about myself, like I've already done, and also about the club that I work for. So we are a community club, and very proud of our relationship in the community and with our fan base. We have got a club vision that runs through the professional team and also through our academy, where we do want to be competitive in all the games that we play. We want to grow our fan base and of course have a profit for our owners. But more importantly for us as people working on the ground floor is that we want to actually develop our own within the club. That's both players and also staff, and also have that really strong relationship with the community and be a positive change within our local community. And our club really kind of shows that in the work that they've done themselves. A few years ago, we renamed our stadium from Loftus Road Stadium to the Khayyam Prince Foundation Stadium after one of our academy graduates who unfortunately died in a single stab wound to the chest. Since that episode, his father, Mark Prince, and along with his wife, set up their foundation, and we're very proud to be associated with such a worthwhile cause. We also, very close to us in West London, had the Grenfell Disaster, and where 72 people died after the block of flats set light in flame. And us as a club, we thought we'd do something for the community and had a game for Grenfell, which was a really nice event. It was there to kind of to provide some funds for really notable causes. Many celebrities came, but just as importantly, people from families that were affected came, and so firefighters, and £450,000 came from that one event, which was really nice to be part of. I mentioned the academy, and in the last 10 years, you can see how things have developed in terms of the amount of appearances, both starting and substitute appearances from players from within our academy. We'd like that to continue, so at least to kind of maintain that number, which is a big source of pride for us as a club. And how do we do compared to other clubs within the Championship? This is data from a couple of years ago, and you can see ourselves in Swansea and also Norwich, when they were in the Championship, provide quite a high percentage of graduate minutes and also total minutes for their first team players, for players who come from the academy. So what am I going to talk about? My role really as a club doctor, it covers quite a wide range of things. Injuries. In terms of health, we do try to look at not only the physical health but also mental and social. Mental health has been looked at in quite a lot more detail in recent years, and I'll touch upon it later on. But also socially, those interactions between players and those interactions also outside the club, I think are really important because they do have an impact on people's health. In terms of performance, we look at the performance of players, and certainly that will be part of our criteria when we get them to return back to play once they've had injuries. But we like to look at how our staff are doing during their time with us, and ultimately how the club is doing in general. Of course, one of the reasons why I put the initial slide up in terms of how our position is, that does make a big difference. So when the club is successful, hopefully some other areas can be successful along with it. So what level of performance are we looking for? So when someone does get injured, the first question they often ask is how long it will take for them to get back. What does getting back mean? Fitness to train, of course, is the first stage, and then depending on the player, there's often quite a lot of pressure to kind of declare them fit to play. All of us know, all the people in that photo, in terms of members of staff, know that the ultimate thing that we have to get people back to is being fit to perform at the level that they need to. So whether it's championship, premiership, or non-professional, can they actually perform their role adequately, not just be on the pitch and just be a body, but actually perform. There's a lot of debate amongst us. So you'll see the manager there, who I would say is the head of performance, myself, head of medical. Next to me is Aaron, who's our head of physiotherapy, and Dan, who's our head sports science. All of us really talk together about performance. We try to push our players to get them to perform at high levels, but also there is that tensional balance between that and an injury risk. Whichever manager you work with, I think it's important to kind of respect their own periodization in terms of their training requirements for the week leading up to games. And I think us as medical staff, we have to really adapt towards that. I think we should give our opinion, of course, that's what we're paid to do, but we will also respect that ultimately it's the man in the middle there who has to make some of the big decisions, and we have to kind of support them very respectfully. But that tension of injuries affects all of us within a club, and the data is out there. So this is again from a couple of seasons ago, and it's not the championship table, it's from the Premiership, looking at the cost of injuries. And these numbers you see on the side, that's millions in terms of pounds, in terms of the costs for those clubs if players are injured. And of course, it depends on the level of player in terms of that cost. But you can see it's quite a big deal. And for me, in my role, again, I have to justify how our department is performing to our director of football, Les Ferdinand, and also to the board on at regular intervals. So us as medics, not just myself as a doctor, but just medics, all of us who work in the medical field, what can we offer professional sport, professional football? I believe coming through the training that we have come through, there are transferable skills. We get to kind of learn to work under pressure, because we have to when we're dealing in healthcare. Working in a place like the NHS, where most of us have trained, we've got good solid clinical governance framework, i.e. looking at risk management, making sure we look at protocols, audits, doing significant events when appropriate, looking at complaints and dealing with them properly, and also, of course, compliments, but just making sure that we're as clinically effective as we can be. We can transfer some of that, not all of it, but some of that to our environment in working in sport. Teaching and developing is a big part of how we train. So making sure that's actually part of what we do. And you probably see before earlier when I mentioned that development of academy players, I've always mentioned staff there as well, because I think that's really important. I always put communication involved on any presentation I give, because that's a massive part of working in this or any environment. The more high pressure environment, I think the better the communication has to be. I think it can be improved in most of the places that I've worked, but certainly working towards that, I think is really important for all staff members. And how us as medics can be seen to be leaders, because at some stages you're kind of expected to be within the medical field, certainly, but also in terms of big things like COVID, things were pointed towards the medical staff, where they weren't necessarily medical, but they were more common sense decisions, because in the end you get seen as being a leader and kind of helping clear decisions. Having said that, football is not the NHS, and again, this is another slide that I often keep in for sports medics. And try to prepare our players to just be fit to kind of leave a clinic room. We're preparing them for the real world of football, which within your you're striving for a high performance is really important to remember. So that's kind of a really important thing for all of us, who certainly those who are new coming into working in football medicine. This is some slides I had from my time before. I used to work in the academy at Tottenham, and you can see when we get kids coming through, it's quite nice actually to see them develop and go through an academy. You see them start off more coddled, and then actually they start developing. They'll go out on loan and some of them then go on to kind of become international. So kind of seeing that journey is really nice. Balance, we are under a lot of pressure as medical staff. We have coaches who get back as early as possible, and there's something to be said about not being too conservative. I'm not talking about this coach in general, but us as medics, we can't be seen to be too conservative. We've got to be safe and actually make right decisions medically, but also that balance between not being too protective. But we get challenged all the time ourselves as staff, but also the players. We get commentators who kind of talk about how things were before. So this is a quote from Graham Soon, so I really like, by the way, in terms of some of his comments. But you'll see over here, he's kind of making statements about big players never being tired, and when he was a player, he wouldn't be tired, and actually the more successful he was, he'd be even less tired. But certainly if he started losing, he would be. So sometimes we're dealing with people talking about how things were very different back in their day, but things are different now in terms of how players are monitored and how they train and work. I like this quote a lot. It's from Brendan Rodgers, and it's a good reminder for us that as we become more experienced in our roles, and probably better at our roles as we get older, we're actually moving away from the very age group that we're trying to affect. So we have to stay modern, we have to stay young without being a duck. But in general, the message is actually, we have to kind of be close to these players, because they're the ones that we are here to try to influence, staying relevant. Communication in football, I'm often asked what that's like, because people often have preconceived ideas of what footballers are like. I really like this picture, because footballers might not be smart academically, like many people who are kind of listening to this webinar, but they're very streetwise smart, and their communication is very good in the main. And you can see over here, this is Alex Ferguson at one of his early days at Manchester United, and you can see almost he's there surrounded by players having to prove himself, because you have to, if you want to gain credibility with players, you have to prove yourself that you're good at your job. So that's probably one really important take-home message for all of us, is to make sure that we're really good at our job. You don't have to be cool, you don't have to be trendy, you just have to be really, really good at your job first, and then you'll get respect, and then you can kind of move forward and build on that. And I'll touch upon that again later on. So acute injuries, what happens? So that's myself and one of our physios, Daryl, who's one of our first team physios. So there's an injury on the pitch. Both of us have gone on in this case. Sometimes he goes on, sometimes I will stay. Either him or Aaron go on, and I'll stay next to the manager. We're mic'd up, and he can relay any information to me. If it's an injury that I need to go on for with him, like a head injury or anything that appears to be serious, or if it's fracture or any sort of blood injury, I'll go on, and then our third physio will then come down and stand by the manager so we can relay information. We have to make a decision there and then whether the player is fit to kind of carry on and stay on the pitch, or if we send them inside to be reviewed inside, and obviously a sub being made. We, on the match day, we have two physios on the a physio on the bench, myself, and also a physiotherapist and a sports therapist behind the bench, and the physio and sports therapist will then go inside and review the player. I took this slide from a presentation I gave to radiologists. That's why it's kind of geared a bit more towards imaging, but the principles are the same. If we feel any sort of imaging will be required in a couple of days, we might book a scan. We don't always, so we're not very kind of scanning everyone in terms of MRI scans, but it being a Saturday, we'd probably book that then if we need to, and then kind of cancel it if we don't need it. We'll then clinically review the player again. So I'll get an update during the game from our therapist, and then I'll then review the player either at halftime or at the end of the game. And then the next day we'll be in again, seeing the player, and then I'll do an ultrasound scan. So by the time they actually have some sort of imaging or on the Monday, we'll have a fair idea of what the injury is, and hopefully be able to discuss timelines. When we actually then get the imaging report, I like to just get the images to myself, actually, just one person, because I think sometimes that kind of spread of information can go really quickly. So you have to, I believe it's important to try to kind of control the information and give it in the right way. I don't like everyone talking about a player's injury before the player knowing. So what I'll do is I'll first of all discuss it with the head physio or whoever I trust or you trust the most within the club. And then maybe a specialist, not always, but maybe a specialist. And then I'll speak to the player, because whenever someone's injured, after I've given them a kind of a diagnosis, which is what this is geared towards, just trying to get an early and quick and accurate diagnosis. The next question the players will ask is when they're back. So I just want to just get as much information as I can. If their partners are with them, I'll kind of discuss things with them if they want to, like on loudspeaker. If parents, they'll do it at the same time. I much prefer having that open communication early at that time, rather than having to have repeated conversations that might change as time goes on. I'll then discuss the injury with the manager, Les Ferdinand, manager who currently is Mark Warburton, and Les Ferdinand, our director of football. I need to let other wider members of the medical staff know, so all of the other therapists that we have, and other members of the medical and sports science team. And then also the wider logistics team. So, for example, I'll need to let someone from admin know, because if the player's not in for whereabouts reasons, we'll need to kind of inform the FA for that. They might need kit on the next day, or they might not need kit coming in. So just kind of letting various people know. I send an update to our board. Our owners are very keen to know about any injuries. We've got consent from the players that we can kind of discuss relevant things with them. So every couple of weeks I'll send an update to them. And then often I'll get asked by our media team for an overview to be kind of released on our social media platforms. I don't give out any clinical information without speaking to the player first. I try to keep it as non-specific as I can do, but I also have to respect that many people are interested in our players, and they want to kind of know some bits of information. And often our players want to give out some information. So that's the process. I'm now going to actually jump all the way to through the rehab process and to what I feel is quite an important process at the end, the return to play. So I know you've had many talks already with very eminent physiotherapists talking about rehab processes. And as long as they're done safely and sequential, and the early timelines are respected, I think the early and the mid phase normally works out quite well. This is our return to play protocol for Queen's Park Rangers. It's not rocket science. It's not anything that's different from what other people do. It's just a nice way that we put things all together, just to make sure that our medical and sports science and then coaching team are on the same page. I really like the end phase of the rehab, when players are returning to kind of full training and returning to play, because it involves so many different members of the team. We have to make sure they've ticked off all their objective markers that we've tested. So we'd have some baseline tests and make sure that they've been ticked off during the rehabilitation. So I'll just pick up one, for example, their speed has to be within 10% of their already known maximal speed. We'll do various jump tests as well. When it comes to actually pitch work, they have to kind of replicate the stuff that they're going to be doing. Again, that's work in different directions after first clearing straight line work, making sure that their accelerations and decelerations are at the appropriate numbers for what they need to kind of get to when they're training with the first team, making sure they're striking the ball at the right intensity with the right repetitions, and also for the length of time. We do want their rehab to be progressive with no regressive symptoms, so we'll always check on that. If an injury requires repeat imaging, we'll have that in the diary already. We don't do that often in terms of MRI imaging, but we'll do it, for example, for higher grade tendon injuries. We'll certainly repeat an MRI scan. I do a lot of ultrasound, musculoskeletal ultrasound myself, so I'll be monitoring players and their injuries during their rehab. I think it's quite a nice thing for players. They quite like it. I certainly like it. I feel part of the injury process with them, and I get to know what's happening, and I can see some of the changes on ultrasound. Of course, I'm cautious with how that's interpreted, because for me, the most important thing is what they're actually doing outside on the pitch. And that's why we put on a review with me for kind of all the injuries, because I feel it's important that I'm very much part of that process. For the players, they have to be part of the process and really medically confident about playing, but they're not as confident, and also vice versa. So having some sort of objective player confidence score. We used IPRS, which is quite a nice, neat, quick score to use. Other places use other ones, but there's something to be said for just making sure there's something documented in terms of how confident a player is in terms of their returning to training. And then when they actually get back to training, depending on the length of the injury, we wouldn't put them straight away available to kind of play in first team games. We want to make sure that they can take part in B team or under 23 matches, and then build up in terms of their minutes. Remember, all the other players have been through pre-season where they played 45, then 60, then 75 or 90 minutes. So the temptation with injured players, especially if they're important players, to get them back in straight away. But just holding it back a little bit at that stage, I feel can actually be beneficial. But it has to be done with context, because there are a lot of people involved in that decision. COVID. So COVID had a massive impact. I'd say, as a head of medical, my personal workload has probably increased 3 times as much since COVID started compared to before. And I probably do less of the musculoskeletal injuries than I'd want to. I still do a lot compared to some other club doctors, because you can really be drowned down in just this kind of information that we have to kind of give with COVID. When we were going through the whole process, when players were training remotely, that was a challenge. When people were off on furlough, that was a challenge. When we were just returning staff in and players in, trying to keep players fit, that's players who were already had injuries, players who were fit, and we had to just make sure that they were physically fit during lockdown. It seems quite a long time ago now, but that was a massive challenge at the time, and a lot of credit has to be given to the clubs and the professional football within the UK to get back to playing during that time, because it was important, not just for us at the club level, but also nationally during those times. It was quite dark days, and football provided something for many people in the country to talk about and feel good about, and just as a distraction. So we did feel that responsibility. What do we have to do practically as a club? We had to, as club medics, we had to kind of do risk assessments ourselves for our training ground, for our stadium, risk assessments for everything, for whether the coming into the training ground was safe or not, having breakfast, using indoor facilities like the changing room, the showers, having lunch afterwards. Each stage was a challenge. Initially, it was pretty straightforward. They had to change at home and shower at home, but it was easy in the beginning because it was summertime and it was quite fun and everyone was enjoying being back. But as we approached winter and it became more obvious that we needed to use indoor facilities, we all know that the risk of transmission of COVID is more indoors, and so those risk assessments had to be even more robust. There was a lot of engagement that we had to do in education for players and staff. Everyone saw the news. It was on the news all the time, so people had their own preconceived ideas about COVID, about transmission, about testing, about mask wearing, about vaccination. It still goes on, and so my role was to firstly respect that, try to understand that people do have different views, but also to try to give what we felt as a medical staff was the most appropriate, best view at this time, and that was tough because it changed all the time, and we can see with some of the guidelines that were changing, we had to kind of be flexible. So I felt a good way to deal with that was just being open and honest and just saying that the evidence that we can give you is the best evidence at this time, and being really, really clear about that. And so if things change, we could always go back and say it's changed for this reason. We're now used to the enhanced hygiene measures. So I'll skip over that bit, but monitoring and testing in football was a big deal. So even now, all of our players, before they come into the training ground, they have to complete a daily health app just to make sure that they're asymptomatic, and so they're household members. If they have any symptoms, then it gets pinged up on my phone, and I'll be able to speak to players and staff straight away. When they come in, initially we were doing PCR testing twice weekly. That then moved to twice weekly lateral flow tests, and now, as of this season in the Championship, we're just going on symptoms. We're not doing regular lateral flow tests. The Premiership are still doing twice weekly lateral flow tests. Of course, when you test, then you have to be prepared for what the outcome could be. So there were positive cases, and there have been across many clubs. Most of the positive cases were asymptomatic, and we had to be able to manage them accordingly, manage their household members accordingly, make sure that there was no outbreaks within the club, and that we could then maintain their physical activity during If they were symptomatic, we then had to see whether they needed any further specialist input, and they invariably needed longer in terms of their return to play with certain tests and more objective markers before they could get back into playing. So that was monitoring and testing. There was a lot of reviewing and collaboration with other stakeholders within the club and outside. I think there was a really nice group for the Championship doctors, and the Premiership doctors, the same thing, where we can share ideas. The Efl Medical Advisors, Baz and Richard worked tirelessly to try to kind of make sure that the guidelines were fit for purpose for what we needed, and they were certainly available for advice whenever we did need. And it was a difficult time, but also a nice time in a way where you can kind of get to know an area quite well. None of us knew about this before, and we had to upskill really quickly. When I first came into kind of sports medicine, I always felt that as a doctor, I had to be really upskilled on concussion management, because often when people had injuries, people would look towards the doctor. I felt I had to be really skilled on cardiac management, so that's both screening and also any cardiac issues. And this is certainly a third C for any doctors who kind of see this, that I think we have responsibility as doctors to really lead on this area if you're working within a club, because the evidence kept changing, and I think it was our responsibility to find out as much as we could and try to kind of translate that in evidence into working practice within a club. I was involved in this infographic with one of our academy doctors, and again, this is the kind of information that we would discuss with players. I don't think anything on the slide would be new to anyone watching. Making sure that there were just good behaviours throughout, and just repeating messages in a nice way, not in a boring way like you're a school teacher, but in a nice way, and so therefore everyone ends up respecting each other and trying to kind of limit any outbreaks. The only way this could happen if there is because there was support from our coaching staff. Our manager was very hot on this, and so was our director of football, and they really backed me at quite difficult times, just to make sure that we all followed the protocols that we felt were safe and sensible during this time. So what was the outcome in terms of the COVID effect season, which is last season? The games, the same number of league games. We had a couple less games because of being knocked out in the cup competitions early, but essentially the games were crammed into kind of a shorter time frame, especially with the Euros that were coming at the end of the season. So essentially there was less training time. We found ourselves, I can't publish all the data from our internal club, but we found that we had less muscle injuries, mainly because we had less training time. So the injuries that accounted from training was certainly less, and essentially we were preparing our players just from match to match, which had its advantages and disadvantages. The advantage was those fit players remained fit, but it was quite tricky and difficult to manage the non-starters who weren't playing as many minutes. So we had to be quite careful to kind of manage those. Going on to look at the kind of stuff that I do as head of medical in terms of audits and what we look at. We've got various charts where we look at the injury incidents from season to season. We like comparing to the season before. I know it's tricky now because of COVID, but we do like comparing our own data with in-house QPR data, so we can try and improve really. So this is our match availability. That was the injury incidents. This is match availability, and we want to try and make sure that we're above 80%, so we can provide a good number of players for our players, for our coaching staff. Again, just a snapshot of injury location. So on the left is 2019-20 season, 2020-21. So what these kind of graphs, what they help me do is really help focus on what kind of areas we want to look at improving. So you can see the big red block is for hamstring injuries in the 2019-20 season. So we really try to kind of focus on reducing those by monitoring players more, adding in Nordic exercises, monitoring their sprints, looking at what they do in terms of recoveries after a match, looking at what they do 2 days before a game and 2 days afterwards. And it was successful. It has been successful so far. We also, as a medical department, I think this is something useful for all medical departments to look at the amount of reoccurrences and return to training injuries that you get. As we all know, it's not just down to us in terms of how many injuries players get. It's a really important triad between the medics like us, sports science, and also coaching periodization. But certainly the recurrence is something that we should be able to have a bit more ownership of. So making sure that our players get back to playing and stay playing. And so since we've not had any significant recurrence, although we still had some return to training injuries that again we reflect on and try to evaluate so we can improve for next year. We like to try to compare to other clubs, so QPR is in white and oppositions in white and QPR is in blue. So this is just like a snapshot. It's not 100% accurate data, but just on any given match day, comparing ourselves to other clubs in terms of how many injuries they have on that day compared to us. So again, it's quite nice to be able to look at other clubs in exactly the same situation as us and seeing if we have more or less injuries. That's something that helps motivate us as medical staff. Performance I've talked a lot about, and performance is not just about training players, it's also about the recovery that they have in between games. I've highlighted what I think are the three most important: hydration, diet, and I got so excited I forgot to put P for sleep. But for me, sleep is a really big thing. In fact, this is the first year we've got a strategy that we're developing for the club with regards to sleep for players and for staff, looking at what they do in season, what they do out of season, what they do when we're traveling as well, because that can have a massive impact on recovery. Often we tend to focus as medics on some of the things or gadgets or gimmicks that look really good, but the basics of the hydration, diet, and sleep, if done well, I think are the most important, and I think many people would agree with that. At QPR, we try to kind of do our own in-house research. We do lots of in-house training sessions and CPD sessions. We did a paper with a previous academy, Dr. Sean, on the exit health examination. Actually, Sean, who's gone on to work at Chelsea women's team, is now doing a PhD in that very area. We're doing some research on communication and the use of WhatsApp within the club in collaboration with Bournemouth University, and that's a physiotherapist, Osman, who works for the England disability teams. And we've done various projects, including the sleep project. We take students as well. We've stopped temporarily because of COVID, but we have had sports therapy students from the University of Hertfordshire, and George Earl, who's one of our previous students. Last year we employed him as a full-time member of staff, and it's been really nice to kind of see him develop and come through. In fact, before I employed him, I actually asked some of the players on their feedback, and they gave really, really good feedback. So having students that obviously enriches a club for many ways, but also it can lead to people eventually being part of your team as well. Other things in terms of education, so quite a lot of educational talks I give to players. I keep them short and sharp, or I try to, a lot shorter than this talk, but normally around 15 minutes or so. We send them WhatsApp messages like this, top tips to keep you healthy. This was actually done before COVID, way before. I was doing this for quite a few years. You can see I'm trying to keep relevant by using some emojis there, but I think the message is that we just send them these kind of information in ways they can kind of digest easily and on their phone, so they can kind of look at them again if need be, or we can reference them again in the future. Other things that we do differently, we're big believers in using boxing to help with our rehabs. We think it's quite a lot of crossover between boxing and football. In fact, we're a club that has a boxing coach with us full time, who understands football. It's something that came quite strongly from Les, and certainly something that I and our staff believe in. He's a big part of our team, Troy, and gets involved in rehabs of our injured players at the appropriate time, and also our fit players. And I've just listed some of the things that it does help with, and I think most importantly, the players really enjoy it. They're doing a lot of really good upper body and lower body CV in a sport that they can kind of really relate to, and it helps with their confidence. And if they enjoy things, it certainly helps in other areas such as their own mental health. But for us, the big thing is the footwork involved in boxing, not just the punching. Talking about punching, I do want to kind of move on and touch about another area of interest of mine, which is mental health. Which when we talk about mental health in football, we shouldn't just limit it just to football. I'll explain why I feel footballers are more at risk, which is why I've got an interest in it. But it affects many of the population, in particular young men, and the numbers in terms of suicide is something that is quite shocking when you actually think about it. So again, it's something that we do support. I know the EFL have supported as well with their links with Mind, which is an excellent charity. The cases that we hear about are big news because they are high-profile cases, and it can affect all levels. I think the PFA have done a really good job by taking it seriously and setting up a welfare system with their 24-hour support for the last few years, and the numbers of people coming through that has increased markedly over the last few years. The Premier League also introduced mental health first aiders. Is that enough? No, I don't think so. I don't think it should just be their responsibility either. I think things like mental health and child protection and some of these big areas are all of our responsibility who work within a club. So I don't think it should be just put into a corner of a club and saying, you know, that's the door for mental health. I think everyone should be aware of what can potentially happen, and also be able to signpost towards the right person who can try and help. And that may well be a club doctor or a psychologist within a club, or it might be someone outside. I've mentioned the PFA over here, but sometimes players don't want to go to the PFA. They want to go and see someone external, someone outside of football completely. So treating everyone as individuals and trying to kind of help support them to get the help they need at that time, I think is really important. I was involved in a study actually during COVID about mental health and see if it worsened during COVID. It was studied by FIFPro, Vincent Gutenberg led it, and it looked at 1,600 professional footballers in England, France, and Holland, and they had questionnaires in terms of their mental health before the pandemic. Fortunately, we had that baseline data and done afterwards, and the take-home message was that amongst this cohort of players, professional players, depression was found to be twice as high and anxiety 3 times higher, which makes sense through what all of us were going through at that time. But why footballers in terms of mental health? There is a big pressure for them to perform, and massive expectations. They have continual monitoring. I've touched upon some of the monitoring in terms of what we do at a club, GPS monitoring. They're also scrutinised outside of the club in terms of social networks. Injuries are a massive risk factor for them, especially long-term injuries. So providing that support that many of the therapists who are listening in do it naturally, but that's something that's to be really kind of wary of. So we do try to screen players who have had long-term injuries and make sure we provide some extra support if it's something that's required. Footballers have to manage change. They have quick changes in contracts. They might have to kind of go to different parts of the country all of a sudden when they've got family and kids set up at schools. So big decisions that they have to make. They can earn quite a lot at the higher levels, and so they have a lot of time as well, and so can get easily distracted by addictions such as gambling, alcohol, drugs. So that's something that many people would have heard about. And then there's unique things about retiring at 35 or in your late 30s, and then trying to kind of start up new careers afterwards. So it's really important they have the right support networks. Just to show some of the scrutiny that happens outside afterwards, when I was at Spurs, we took snapshots of some of the players before and after they went into the first team squad on pre-season tours. And you can see on the left, some of the followers were between, for these players was on Twitter were between 2,000 to 4,000. And then within a week after they got into the first team squad, it jumped up to between 13 to 50,000 followers on social media. So just to show that these are real people, they've got all of a sudden a lot of fame, and then along with that fame comes responsibility and people contact them about various things. So it's worth bearing that in mind in terms of the positive as well as the negative scrutiny that they're under. And so it must be hard for them because in the end, they've got so many people around them, including social media, who can they actually end up trusting. And so for the last bit of my talk, I just want to just talk about how we can try and become one of those trusted people for footballers. Because I think whether you're working in a football club or any other sports club, or working in any sort of organisation, I think we'll start recognising that the best people in that organisation, they really care. So they'll care for themselves, for other people, and also for that organisation. For me, the two most important relationships in football are between player to player, which is why I've got a picture of two players over here, a younger and an older player, and between a player and coach. I think that's vital. Those kind of communication are really vital, and I think people like us are there to kind of help support some of those relationships and make those stronger as well. For us, I think players need to know that we care. And the best way to show care itself is by communicating well, which is why I highlighted that early. The best way that any of the evidence shows about communicating well is to listen, which I know I haven't done much in this 40 minutes, but I think you get the message. If you've got good listening skills, then you're generally seen to be a better communicator. And you have to be interested in the player, the coach, the environment, and so hopefully you can then make an impact on that environment. I think is really important. The more experience you get, the more you realise that recruitment and getting the right stuff in your team is crucial. This slide, or the picture on the right, just shows physicians and administrative staff. It's an American slide, but in hospitals. So you'll see the physicians over time is in green at the bottom. So there's been a slow increase in physicians over time, but a massive increase in the non-physicians within those hospitals. So a lot of more administrative staff. And I think this kind of stuff was really highlighted during COVID and pandemic when people were on furlough. We were having to make real decisions about which members of staff were to come back and when. So I think when you're working in an organisation, providing value over and above what you normally see as your job role, I think is probably quite important as time goes on. I think the baseline, or the first thing, is you have to be really good at your job. That's why I put that first on the list. It is a very competitive environment, and I think we want people to be competitive in terms of staff, but also respectful to each other. I've mentioned before about the credibility with players, and they get that because they're quite streetwise smart in terms of how they see people. If we see ourselves as player and staff developers, that I think makes our job a lot more interesting. If we can bring ideas to the club, not just medical ideas, other ideas as well to a club, that's good. And if we can then eventually contribute to the culture and move an organisation forward, I think you can become an asset to the club, whichever level that you're working at. I've talked so far about what we can offer professional sport, but I think we can learn loads as well from working in professional sport. There's certainly a lot of accountability for performance for all of our coaching staff, and I think we should be like that as well. And that's why I keep all the data, or some of the data that I've shown, because I want to be accountable for the medical department that I lead, and also I want to reflect on how we've done and try to kind of improve as time goes forward, because that's what everyone else has to do within this environment. I've certainly learned lots about leadership from the coaches that I've worked with, and I still, and I think that's probably where I was most from working in an environment. Is that we as medics, we're here to kind of give opinions and really be confident about giving that opinion without being too abrasive about it. We hear a lot about marginal gains. This is some of the work that's where you want to try to improve those 1% and try to kind of make those 1% areas better, make the helmet smoother, the cyclists will go a bit faster. I think that concept is good, but only after you're brilliant at the basics. So you can then develop those special skills, you can then develop those 1%. This is nothing new. This is something that I think most of us recognise, but actually doing it is probably the harder bit. Even for the basics, there are some internal truths, and that's why I put that book up, Beyond Winning. It's quite nice. It goes through some of the truths that some coaches from America picked up and developed during their time over there. So Vince Lombardi would often talk about how not talk about, but he'd reflect how organised he was and how it'd come across how determined he was to kind of lead and get the right team. Woody Hayes would make sure he has the right team and have a lot of confidence in that team. So I picked up things, or tried to pick up things from there. And John Wooden talks a lot about hard work and the substitute for that hard work, but also to have enthusiasm, because we're in this environment a lot, we're working long hours, so enjoying that I think is really important, so having that natural enthusiasm. I think I'm done. So my last slide before I take any questions, I've tried to cover health and performance. I've talked about understanding the organisation that you work for. I think that's really important, because then you can then try to contribute to it. I think the first thing is get your own houses in order and make sure that we all do our own jobs to a high standard. So I've made sure I've tried to kind of always maintain my medical and musculoskeletal skills, and then kind of build up on that. Be confident in giving opinion. That's what people have employed you for. So do it respectfully, but definitely give your opinion. I think top staff can really help beyond the work of what medics tend to do, and actually help to kind of influence the culture of an organisation. Make sure we do our basics first before we start looking at those little 1%ers. And again, I'll just finish on communication being really important in all areas. Thank you. I think I'm done. And ready to take any questions.
Thank you, Imtiaz. It's really enjoyable and informative talk. We've got a few questions in the Q&A, and a few have been bumped up to the top as well. So we'll start with Gabriella. Do you ever have to deal with conflict over how long a player is out for? And if so, how do you deal with it?
Yes, all the time. I would say every week, most days. How do we deal with it? I suppose it depends on how you define conflict. I wouldn't have full-blown arguments. That's not my style, but I would certainly give my opinion, and I do that all the time to our physiotherapy team, our sports science team, to the manager, and also to the director of football. What I like to do is to have one-to-one conversations and then back them up with group conversations and then maybe emails. I think if you get any of those wrong, you can sometimes cause issues. So if you send a group email out, it can be seen as aggressive. If you start discussing things in the big group, the stakes go high. So I like to kind of have one-to-one conversations first to make sure we're on the same page. If we're not, I think it's really important that people understand where you're coming from, and then you then work out work with the best decision, the final decision, and then not kind of be annoyed that it's not what you felt was the right thing.
You touched on mental health quite a bit. How would you? Zarinka asked, would you include mental health into a risk assessment?
Yes, I think so. So we do that for our screening for new players and our screening at the beginning of the season, and also for those who are injured. So I think screening questions are well known and quite simple to do. It depends in terms of how far the risks you want to do. So if the screening is fine, then you just carry on as normal. If there's anything that's highlighted, you would then either do any further assessment yourself or signpost towards someone who can do that. I like things being done in the right way, but also, like I said before, I don't want us to become too much like the NHS, where you have to kind of do every single thing for every single person, because that's not real football in this environment. So you have to understand the environment as well, for sure. But mental health being such a big thing, I think it's something that people are much more happy talking about.
Absolutely. A few more questions come in. How prevalent is Reds in football? How influential do you think it has on injury occurrence and return to play timeline?
I missed a bit when you said how prevalent is what in football?
Reds.
Reds.
Red S.
Sorry, I missed that again. Say it again.
Red S.
Oh, right. Okay, fine. Sorry. Yeah, Red S. I think it is prevalent, especially because they're working so hard. There's not an exact way to kind of pick it up yet ourselves, so we don't do any sort of screening ourselves for it. And I think it's an area that many of us can improve on. There are other measures of fatigue that we do look at and we monitor quite regularly throughout. There are certain new things that we're looking at to kind of pick up as markers for that. But I don't think we've got there yet in terms of doing it properly within an environment, within football, in season. I'm not reading the questions, by the way, so I'm only going by what you're saying. So forgive me. Yeah.
No problem. There's been a lot of discussion over the last 18 months about the pandemic and COVID. And Connor asks, how did you respond to and deal with players who didn't or don't want to be vaccinated?
Yeah, that's a really good and topical question. I'm going to be doing an update in a couple of weeks to Australian Doctors Conference, because they're quite a few bit behind us in terms of their return to play, and you can see what's going on over there. So it's such a topical issue. People have strong views about vaccination. They've formed their views, and I think what I try to do is try to inform them from our perspective and my perspective. I've given talks as a group. I've been very open about it, about what the current guidelines and evidence is. I've given one-to-one talks to everyone. I've spoken to them on WhatsApp themselves. I've spoken to family members as well. I've also given talks, given a presentation on our social media feed. So seeing some of the feedback that came from there, I can see that people have some really, really strong views. I think you can't force anyone to do anything. That's the first thing. That's the first principle that we have to adhere to. I do think we have a responsibility to kind of get our information across in the right ways. But I think there's so much emotion attached to a lot of these areas that people sometimes need to just take a step back and just talk on a normal level, try to understand why why people are not having the vaccinations, whether it's because of any, whether they're scared, whether any preconceived ideas, whether they've got fixed strong beliefs or not, and then working on those if you can. And sometimes you might not be able to, and just accepting that you can't do it all the time. You probably saw the kind of little talk that Jurgen Klopp gave on his press conference a few days ago, and he was quite strong in terms of what he said. And it's quite hard to have that strong viewpoint because you get attacked from all areas. And I know Gav Southgate a little while ago gave similar views or supported the vaccination program, and he received quite a lot of abuse as well. So there is quite a strong anti-group, so you have to be quite careful in how you kind of get across it. But going back to the original question, in terms of the players, I'd want to understand it first and then try to kind of change them. And it has happened for some people, especially now with the impact on the social impact that's becoming more evident as time goes on. Do you think that's answered? Okay, yeah.
Yeah, with regards to the press, Hussein asks, do you or the club management have to seek permission from the player to reveal to the press / media team about the injury?
Yes, yeah, always. So nothing will be released without a sign off from me and the manager and the player having read exactly every single word that I'll talk about an injury. And if they say no, which has happened in the past, we won't do it. Most of the time it's actually us saying no. So if you were to ask a player or manager, often they'll give out more information, and it's normally us as medics trying to kind of hold back. But yeah, without fail, the player is always involved and sees what goes out beforehand.
Just pick a few more questions from here. If a player is suffering from mental health issues and they have to come to you and they've said they don't want you to tell the manager as they're afraid of being dropped from the team, can you keep this information confidential, or must this information be shared with the first team managers and may impact on the team's performance?
I think you have to judge each case individually, but the quick or easy answer is yes, you have to keep it confidential. Certainly if a player says that. Remember, we're not there to pick the team, we're there to make sure that the players are healthy. And that's why I included mental and social health in that as well. There are some areas where a manager might need to know if it affects performance, but remember, the manager's picking their teams based on performances in training and also matches. And in most cases, if a player said that to you and then you then go and tell the manager against their confidence, it'll probably worsen their mental health and ultimately their performance. So they do get to trust us as medics, not just as a doctor, as medics they're closely working to. In fact, they'll trust our physiotherapists a lot more than me at times, because they spend much longer with them. So I think we have to kind of respect that. And again, I said we're not the NHS, but we have to take the good parts of the NHS, and working in medicine as we do, we have to respect patient confidentiality.
We'll just pick a couple more questions here. You mentioned you had to upskill on concussion and cardiac screening and assessment.
Yeah.
The question is, how do you do this? And do you recommend any resources, courses for it?
Yeah, I think now it's easier because the FA put on a lot of good resources. So if you wanted to get into emergency medicine, where it covers certainly concussion and some aspects of cardiac, and then doing the FA approved ATMIF course, which many of you would have heard of. At our club, I get everyone to do it, including the sports therapists. So I think that's important. I think it is quite a big jump in some areas and some of the medical treatments of cardiac issues, but I think knowing about it is better than not knowing about it. You might not necessarily have to lead in those areas yourself, but you might work with someone who might not be as confident at times, and so at least you know what good or bad is. So I think the FA approved courses are really good. There's diplomas in football medicine. There's conferences like this. There's the Efl Medical Society, which you can all join. If you want to attend any meetings, you don't have to, but you can. And sharing ideas with each other. Now, gaining knowledge, I don't believe is as hard as it used to be, especially with on the internet and various resources. I think applying it is hard, and actually thinking outside the box is a lot harder. But I would still say they're the priority. Make sure you're really hot on your injury management, and if there are any doctors out there on concussion, cardiac, and COVID, and then you can build on the other stuff from there.
Just going to pick one last question before we wrap things up. So what is your advice for a current medical student who is interested in going to sports medicine? Did you always want to go into sports medicine as a medical student?
As a medical student, no. I was always really into sport and played at university in terms of football. I did my rotation and realized that I then started sitting in a sports medicine clinic after I tore my own ACL and went through the rehab process and thought that's an area that I wanted to get into. So I think there's a lot of places where you can gain experience as a sports medicine doctor or aspiring medical student who wants to. You can do things. You don't have to sit in with myself at QPR or somebody else at Tottenham or Liverpool. To kind of help. So start at a lower level, build up your skills, become confident and competent, because when you're confident and competent, then chances will, then opportunities will then come up. And when opportunities come up, I think it's important then to be available. I suppose that's the other really important thing. I know it's a bit boring, but people will all of a sudden last minute say there's a game to cover, or you know, they have to kind of have a training match to cover, or somebody's gone off sick. If you can drop other things and be available, that's quite a good thing, because it helps out, and then people remember you. But of course, you have to be ready for that. So you have to make sure you upskill beforehand, do the relevant courses, make sure you're indemnity those, you know, those kind of things, and then you're ready. I know that's a bit of a wishy-washy answer, but I'd say you need to go through all those things, see enough patients, make sure you do enough rehabs, work with enough excellent physiotherapists, sports therapists, and other medics, so that you learn at this stage in your career, so therefore you're ready later on, because what you don't want to do is get a job too soon. I became a GP, then did sports medicine, then started working with the England women's team, travelling with the FA for a couple of years, and then in 2007 I got an opportunity to work at Millwall. I first started off in the academy, and then very quickly they asked me to work in the first team, and I couldn't say no. It was a big club it still is a big club. I was going to say it's a big club at the time, but I worked in League One and the Championship, and I just remember for the first few years, I just got by being nice. I really didn't know much because I was just starting off in my career, but I was just nice and hardworking, and every injury I'd look at and revise and learn about it and read about it. And I believe you have to kind of spend time doing that, whatever level you're working at first. And it's usually safer to work at a lower level like that and get your knowledge base. And then when the pressure's on at a higher level, you're ready for it.
That's great. Thank you very much for such an informative talk, Imtiaz. It was really, really, really good. Thank you. Okay,
no problem at all. Thank you.
Yeah, just to say thanks very much, Imtiaz, and thanks everyone for joining. Thanks, Ryan, for comparing there. Really good to get an insight into your role, and thanks very much for sharing so much information. Is there any final comments from Ryan or Imtiaz before we sign off? Or?
No, just a big thank you from myself, and I'll look forward to looking at some of the other webinars, because you've got a really good program going forward. Thank you.
Thanks again. Thanks very much. I think we'll get cut off quite abruptly now, Ryan. Is that right?
Yeah, I think it's time for some tea.
All right. Thanks, everyone. See you again soon. Thanks,
everyone. Thank you. Thanks for joining us.
No problem. Bye-bye.